You woke up this morning, and before you reached for your phone, before you checked the time, before your eyes were even fully open, you felt it, that strange, uncomfortable dryness in your mouth. Your lips felt tight, cracked, your tongue felt heavy, almost stuck to the roof of your mouth, and before your mind was even fully awake, your body was already asking for one thing: water, just enough to feel normal again. If that sounds familiar, I need you to stop and pay close attention to what I'm about to say. Because waking up with a dry mouth every morning may seem harmless. Most people blame it on sleeping the wrong way, not drinking enough water, or simply getting older. But sometimes, that dryness is not random. Sometimes it is one of the earliest warning signs your body sends before a deeper problem becomes impossible to ignore. And that is what makes this so dangerous. Most people dismiss it. They brush their teeth, drink a glass of water, and move on with their day, never realizing their body may have been trying to warn them for weeks, months, or even years. In my years of practice, I have spoken with many patients who described this exact symptom: dry mouth every morning, dry lips, that desperate need for water the moment they woke up, and almost every one of them told me the same thing. I thought it was nothing until we looked deeper. And in some cases, what we found was far more serious than they ever expected. By the end of this video, you'll understand what your body may be trying to tell you when you wake up with a dry mouth and dry lips, what hidden conditions may be causing it, and what you can do starting today to protect your health. I'm Dr. Louren, and on this channel, I help you decode the warning signs your body sends before they turn into bigger problems. If you want clear, honest, medically grounded information that can help you catch problems early, subscribe now and turn on notifications. Because sometimes the smallest signal changes everything. Let's begin. Before we talk about the causes, let me explain what's actually happening. Your mouth is supposed to stay moist while you sleep. That moisture comes from saliva, and saliva is not just water. It is one of the most important protective fluids in your body. It helps break down food, protects your teeth, fights harmful bacteria, supports your gums, and keeps the tissues inside your mouth healthy and stable. Even while you sleep, your salivary glands are supposed to keep producing enough moisture to protect you through the night. So, if you wake up feeling like your mouth has been completely dried out, something in that system is no longer working the way it should. Either your body is producing too little saliva, or something is causing that moisture to disappear faster than your body can replace it. And that is where the real story begins, because sometimes the cause is simple, but other times it is a warning sign. A warning most people miss. Reason 1: mouth breathing and the hidden risk of sleep apnea. Let's start with something many people underestimate: mouth breathing. If you sleep with your mouth open, air moves across the tissues of your mouth hour after hour, drying your tongue, gums, cheeks, and lips throughout the night. Your nose was designed to warm, filter, and humidify the air you breathe. But when you bypass that system and breathe through your mouth instead, you lose all of that protection. So yes, mouth breathing alone can cause dry mouth, but here is where it becomes more serious. Mouth breathing at night is often not just a habit, it can be a clue: a blocked nose from allergies, chronic sinus issues, a deviated septum, nasal polyps, or something even more concerning: sleep apnea. Obstructive sleep apnea happens when the airway partially or completely collapses during sleep. The body struggles for oxygen, and one way it tries to compensate is by forcing the mouth open to pull in more air. That means a dry mouth in the morning may not just be dryness, it may be evidence that your body was struggling to breathe while you slept. If you also snore loudly, wake up exhausted, get morning headaches, feel foggy during the day, or have ever been told you gasp or choke during sleep, do not ignore this. Sleep apnea is linked to high blood pressure, heart disease, stroke, diabetes, and serious cardiovascular complications. And sometimes the first clue is the one most people overlook: a dry mouth every morning. This is one that surprises a lot of people. A persistently dry mouth can be one of the earliest signs of prediabetes or type 2 diabetes. Here's why. When blood sugar stays elevated, your kidneys work harder to remove excess glucose from the body. That leads to more frequent urination. More urination leads to fluid loss, and fluid loss leads to dehydration. And one of the first places dehydration shows up is in your mouth. But it doesn't stop there. High blood sugar can also affect the blood vessels and nerves that help regulate your salivary glands. So even if you are drinking water, your body may still struggle to produce enough saliva. That means your dry mouth may not simply be from needing more water. It may be a metabolic warning sign. If you are also feeling unusually thirsty, using the bathroom more often, waking up at night to urinate, feeling tired, noticing blurry vision, or seeing that cuts and wounds are healing more slowly than they used to, please do not ignore it. A simple blood sugar test can reveal a great deal, and catching abnormal blood sugar early can change the course of your future health. This is one of the most common causes and one of the most overlooked. Many medications can cause dry mouth. In fact, there are hundreds of them: antihistamines, antidepressants, blood pressure medications, diuretics, anti-anxiety medications, muscle relaxers, pain medications, decongestants, bladder medications. Some reduce saliva directly, others dry out the body more generally. So, if your dry mouth started around the same time you began a new medication, that timing may not be a coincidence. It may be the answer. And let me be very clear, this does not mean you should stop taking your medication on your own. It means you should speak with your doctor and say, specifically, since starting this medication, I've been waking up with a dry mouth every morning. Could this be related? That conversation matters, because sometimes there is an alternative. Sometimes the dose can be adjusted. And sometimes there are ways to manage the dryness without sacrificing the treatment you need. But none of that can happen if you never connect the dots. Now we move into a cause many people have never heard of, and that is part of what makes it so dangerous. Sjögren's syndrome is an autoimmune disorder in which the immune system mistakenly attacks the glands responsible for producing moisture. Most often, it targets the salivary glands and tear glands. That means one of the earliest symptoms can be exactly this: a dry mouth every morning. Dry, irritated, gritty eyes, difficulty swallowing dry foods, a change in taste, sometimes fatigue, sometimes joint pain, sometimes just a lingering feeling that your body hasn't felt quite right for a long time. And because these symptoms can develop slowly, many women ignore them for far too long. Yes, women are more commonly affected. And for some, waking up with a dry mouth every morning is one of the first quiet clues. If this sounds familiar, please bring it up with your doctor, not casually, specifically, because early diagnosis can make a significant difference. Now let's talk about something simple, but often more serious than people think: chronic dehydration. A lot of people assume they are drinking enough, but when you look closely, many are relying on coffee, tea, soda, or other beverages that may not hydrate the body as effectively as they think. Then, in the evening, they stop drinking water to avoid getting up during the night. So by morning, the body may have gone 8, 9, or even 10 hours without fluid, while already starting the night behind. And the result is predictable: dry mouth, dry lips, fatigue, brain fog, constipation, headaches, low energy, stiffness. Chronic dehydration affects the entire body. So yes, sometimes the signal really is that simple. But when dehydration becomes a daily pattern, it can quietly affect far more than your comfort. A dry mouth in the morning may be the first thing you notice. It may not be the only thing happening. This connection surprises many people. What does your stomach have to do with a dry mouth? Quite a lot, actually. When stomach acid repeatedly flows back into the esophagus and throat during the night, it can inflame the tissues and disrupt normal saliva function. Some people with reflux also begin sleeping with their mouth open or adjusting their sleeping position in ways that worsen mouth breathing and dryness. So if your dry mouth comes with heartburn, a sour taste, throat irritation, hoarseness, a chronic cough, or the feeling that something is stuck in your throat, acid reflux may be part of the picture. And once again, this is why context matters. A dry mouth alone may seem small, but a dry mouth plus other symptoms can point to something much bigger. You've felt it before. That moment of stress when your mouth suddenly goes dry, that is not in your imagination. It is your nervous system shifting into survival mode. When the body is under stress, it prioritizes immediate survival over everything else. Digestion slows, relaxation fades, saliva production drops. Now imagine that not as a brief moment, but as your everyday reality. If you are living in a constant state of tension, worry, overwhelm, or anxiety, your nervous system may be keeping your body in that activated state far more often than you realize. And sometimes the effects show up first in the mouth, especially in the morning when stress hormones are already rising naturally. So if your dry mouth seems worse during stressful periods, or you know your mind has been under constant pressure, your nervous system may be playing a much bigger role than you think. This is where things shift from uncomfortable to damaging, because saliva is not optional. It is one of the primary ways your mouth protects itself. Saliva helps control bacteria, neutralize acids, wash away food particles, and rebuild tooth enamel with essential minerals. Without enough saliva, the entire balance inside your mouth starts to break down. That means more cavities, more bad breath, more gum disease, a higher risk of oral infections like thrush. And if you wear dentures, more irritation and discomfort. I have seen patients go from years of stable dental health to multiple new oral problems in a surprisingly short time, and chronic dry mouth was the missing piece no one had recognized. So, if this is happening to you, do not think of it as a minor inconvenience. Your mouth may already be paying the price. Sometimes the problem is not only inside the body, sometimes it is in the room around you. During colder months, heating systems can dry out the air dramatically, and dry air pulls moisture from your skin, your nose, your throat, and your mouth all night long. That means even if you are reasonably hydrated, your sleeping environment may still be making the problem worse. A humidifier in the bedroom can make a real difference for some people. It is a simple fix, but sometimes simple fixes are powerful, especially when they remove one more layer of dryness your body has been fighting all night. And now we come to two of the most common daily habits that quietly worsen dry mouth: alcohol and tobacco. Alcohol increases fluid loss, making dehydration worse overnight. Even a couple of drinks in the evening can leave your body drier by morning than you realize. Tobacco is even more harmful. It irritates the mouth, damages tissues, and can affect the salivary glands directly over time. So, if either of these are part of your daily or nightly routine and you wake up dry every morning, there is a very real possibility they are contributing. And if this has been happening for a long time, the damage may be building more quietly than you think. So, what should you take away from all of this? This. Waking up with a dry mouth and dry lips every morning is not something you should automatically ignore. It is a symptom. And symptoms are messages. Sometimes the message is simple: you need more water, better air humidity, nasal breathing, less alcohol. But sometimes the message is more serious. Sometimes it points to blood sugar problems, sleep apnea, medication side effects, autoimmune disease, reflux, chronic stress. So if this has been happening regularly for weeks or months, don't just treat the symptom. Investigate the cause. Here are some practical steps you can start today. Drink water consistently throughout the day, not just when you feel thirsty. Keep a glass of water by your bed. Use an alcohol-free mouth rinse or an oral moisturizing gel if needed. Chew sugar-free gum with xylitol to stimulate saliva. Avoid overly salty, spicy, acidic, or sugary foods if dryness is severe. Try to train yourself to breathe through your nose while sleeping. If nasal blockage is a problem, consider seeing an ENT specialist. Use a humidifier in your bedroom, and most importantly, if you also have excessive thirst, frequent urination, loud snoring, gasping at night, gritty eyes, joint pain, fatigue, or any other unexplained symptoms, please make an appointment with your doctor. Get the right tests, look deeper. Because sometimes the truth only becomes clear when all the symptoms are finally placed together. Your body is always speaking. The question is whether you are listening. A dry mouth in the morning may seem small, easy to dismiss, easy to explain away, easy to forget, but many serious conditions begin exactly like that, quietly, subtly, with one repeating signal that most people ignore until it becomes impossible to ignore anymore. Don't be that person. Be the person who pays attention early. Be the person who listens while the warning is still small. Be the person who acts before the problem has the chance to grow. If this video helped you understand what your body may be trying to tell you, give it a thumbs up and share it with someone you care about. Because one simple symptom, recognized in time, can change everything. Subscribe to the channel and turn on notifications for more clear, practical, medically informed videos every week. And tell me in the comments, do you wake up with a dry mouth in the morning? How long has it been happening? And have you noticed any of the other symptoms we talked about today? I'm Dr. Louren Hayes. Listen to your body, take its signals seriously, and never underestimate the warning signs that show up quietly, day after day, before something bigger reveals itself. Because sometimes the smallest symptom is the first chapter of a much larger story.